Colorectal cancer is a significant and prevalent form of cancer that targets the colon and rectum, parts of the large intestine. Sadly, it stands as the third leading cause of cancer-related deaths worldwide. It originates from genetic mutations in the cells lining the colon, often stemming from non-cancerous polyps that can gradually become cancerous over time. The most common type of colon cancer is adenocarcinoma, which develops in the mucus-producing cells that line the colon. If left untreated, colon cancer can metastasize to nearby lymph nodes and other organs, posing greater challenges in treatment. Numerous factors contribute to the development of colon cancer, including age over 50, family history of the disease, genetic mutations, lifestyle choices, and certain dietary habits. By recognizing the significance of colon cancer and implementing preventive measures, we can promote colon health and reduce the risk of the disease. In this video, we will guide you through 7 simple yet highly effective steps to prevent colon cancer and boost your gastrointestinal health. Let's start with the role of whole grains in reducing the risk of colon cancer. Whole grains, such as whole wheat, brown rice, oats, and barley, hold incredible benefits in reducing the risk of colon cancer. These grains are rich in dietary fiber, a crucial component that aids in regular bowel movements and decreases the time waste materials spent in the colon. By diluting and eliminating potentially harmful substances and carcinogens, whole grains actively reduce the risk of colon cancer. Moreover, they contain resistant starch and other carbohydrates that ferment in the colon, producing a short-chain fatty acid called butyrate. Butyrate possesses anti-inflammatory properties and is believed to inhibit the growth of cancer cells in the colon. Aim for a daily intake of 90 grams of whole grains to reap these health benefits. Step number 2. Opt for healthy fats, shun the unhealthy. High-fat diets, particularly those abundant in saturated and trans fats, have been closely linked to an increased incidence of colon cancer. Unhealthy fats contribute to chronic inflammation, heightened oxidative stress, and an imbalance in the gut microbiota, known as dysbiosis. Furthermore, they can lead to insulin resistance and obesity, creating an environment conducive to cancer development in the colon. To cut down on unhealthy fats and minimize the risk of colon cancer, choose lean sources of protein such as skinless poultry, fish, legumes, and tofu. Remove visible fat and skin from meat. Swap saturated and trans fats with healthier oils like olive oil, canola oil, or avocado oil for cooking and making salad dressings. Minimize consumption of fried foods and processed snacks. Be cautious with condiments and sauces, as many of them contain unhealthy fats. Consider healthier alternatives, like mustard. Select low-fat or vinaigrette dressings to add flavor to your dishes. Use healthier cooking techniques like baking, steaming, grilling, or stir-frying with minimal oil, and add a burst of flavor to your meals with herbs, spices, and citrus juices instead of relying on heavy creams, butter, or excessive salt. Step number 3. Curb processed meats and limit red meat. Processed meats, including hot dogs, bacon, and sausages, fall under Group 1 carcinogens, meaning they have a proven association with cancer development. Red meat, such as beef, pork, and lamb, falls into Group 2A, indicating it is likely carcinogenic to humans. Therefore, it is not surprising that consuming red meat and processed meat have been consistently associated with an increased risk of colon cancer. Cooking red meat at high temperatures like grilling or frying can produce harmful compounds called heterocyclic amines and polycyclic aromatic hydrocarbons that promote cancer growth, while processed meats may contain nitrates and nitrites, which can form carcinogenic substances known as N-nitroso compounds in the body. To protect your colon, limit consumption to no more than 500 grams of cooked red meat per week, and strive to avoid processed meats altogether. Step number 4. Moderate alcohol consumption. Studies have consistently shown that consuming more than 2 alcoholic drinks per day increases the risk of colon cancer. Alcohol is broken down into acetaldehyde, a harmful substance that damages DNA and impairs DNA repair mechanisms. Acetaldehyde, formed during alcohol breakdown, can contribute to the development of cancer in the colon. Additionally, alcohol consumption leads to the production of reactive oxygen species, causing oxidative stress and cell damage. Regular and heavy alcohol intake can also result in poor nutrition and deficiencies in vital nutrients like folate, vitamin B6, and vitamin D, which play significant roles in maintaining healthy cells and facilitating DNA repair in the colon. To minimize the risk of colon cancer, it's advisable to limit alcohol intake to no more than 2 drinks per day and consider healthier alternatives. Step number 5. Embrace an active lifestyle. Physical inactivity has been associated with an increased likelihood of developing colon cancer. Engaging in regular physical activity can reduce the risk by 27%. Exercise offers several protective benefits, including regulation of insulin levels, improvement in insulin sensitivity, and maintenance of a healthy body weight. Regular physical activity also enhances digestive system function, improves bowel motility, and reduces the contact time between potentially harmful substances and the colon lining. Aim for at least 150 minutes of moderate-intensity aerobic activity or 75 minutes of vigorous intensity aerobic activity per week. This translates to about 30 minutes of exercise on most days of the week. Remember that any amount of physical activity is better than none. If you are currently inactive, even starting with small increments of exercise and gradually increasing the duration and intensity can be beneficial. Step number 6. Harness the power of calcium. Studies have revealed that higher intake of calcium, whether from dietary sources or supplements, is associated with a 20 to 30% lower risk of colorectal cancer. Calcium binds to substances in the colon, such as bile acids and fatty acids, reducing their harmful effects on the colon lining. It may also inhibit the growth of abnormal or cancerous cells in the colon, preventing tumor formation. Aim for 1,000 to 1,200 milligrams of calcium per day, which can be obtained from dairy products and leafy greens. Ensure your diet includes sufficient calcium to support overall well-being and reduce the risk of colon cancer. Step number 7. Prioritize colorectal cancer screening. Colorectal cancer screening tests play a pivotal role in risk reduction through early detection and intervention. Tests like colonoscopy can identify precancerous polyps or early-stage cancer, even before symptoms manifest. This early detection allows for timely treatment, improving the chances of successful outcomes and reducing the risk of cancer progression. Additionally, colonoscopies enable the removal of polyps, eliminating the potential source of cancer development. Regular surveillance colonoscopies are recommended for individuals with a history of polyps or previous colorectal cancer, facilitating close monitoring and early intervention if needed. Considering screening options, colonoscopy is the most effective method for detecting and preventing colon cancer. However, we understand that cost and accessibility can be barriers for some individuals. In such cases, the fecal occult blood test offers a more affordable and accessible alternative. It detects blood in the stool, which may indicate colon cancer or other gastrointestinal conditions. Choosing between fecal test and colonoscopy depends on individual preferences, risk factors, and access to healthcare resources. Fecal occult blood test serves as a reasonable initial screening tool, while colonoscopy provides comprehensive screening and the opportunity for polyp removal. In conclusion, by implementing these 7 steps, you can actively reduce the risk of colon cancer and promote gastrointestinal health. Remember, prevention starts with knowledge and action. Stay informed, make mindful choices, and take control of your health. Also, if you need to get familiar with early symptoms of colon cancer, go through the next video.